Margaret is 68. She lives in Manchester. She has had COPD for 6 years and she was hospitalized twice last year. Sent home each time with steroids, antibiotics, and the same instruction she's had for 6 years. Keep using your inhalers. Then, 6 months ago, her GP said something different. There is a new injection that might help you. I will get you referred. Margaret went home and waited through winter, through two more chest infections, through a phone call that never came. When she finally sat across from me, she asked the question I hear far too often. Nice, approved it. My GP said it exists. So why I am still sitting here, still ending up in hospital? I am Dr. Suman Paul, consultant respiratory physician working in the NHS and private practice, and a principal investigator in COPD clinical trials. That question deserves a proper answer. Stay with me because it comes down to one number most patients have never been told about. Quick disclaimer first, I'm a doctor, but I'm not your doctor. This is education only, not medical advice. If you are struggling to breathe at rest right now, call 999 or see your doctor. Now, that one number, it's a single result from a routine blood test your GP can request this week. It's the gateway to COPD biologic injections. Without it, nothing else applies. With it, everything changes. And here is the problem. Most COPD patients have never been told it was even measured the last time they had bloods taken. But before that number means anything, you need to understand who this injection is actually for. Because it's simpler than most people think. Here is the simplest way to know if this conversation applies to you. If you have COPD, you are taking your inhalers exactly as prescribed and you are still having flare ups, still needing steroids and antibiotic, still ending up in hospital, then your current treatment isn't enough. That's the group this injection was designed for, not the mildest patients, the ones who are doing everything right and still can't get their breathing under control. If that's you, keep watching closely. So where does this injections actually fit in COPD? Because most patients are missing the rung of the ladder where it lives. COPD treatment is a ladder. First, long-acting inhalers that keep your airways open. Then, triple therapy, adding an inhaled steroid, three medicines often in one device. And for most people, that works well. But there is a step beyond that most patients have never been told about. For people on triple therapy, doing everything right, still ending up in hospital. Two inhalers were never enough, and three still aren't. This is where the biologic injections enter, not as a replacement for your inhalers, as the next rung on the ladder. If you have ever ended up in hospital despite taking every inhaler exactly as prescribed, drop a comment below because this video is for you. Now let me show you what this injection actually is. The injection is called dupilumab, brand name Dupixent, and it works in a way completely unlike any inhaler you have ever used. Inhalers work directly on your airways, opening them, reducing mucus, delivering steroid locally. Dupilumab doesn't touch your airways at all. It targets your immune system. It blocks two chemical signals, interleukin 4 and interleukin 13, alarm bells that in certain COPD patients won't switch off. They keep firing, driving inflammation long after any infection has cleared. The airways stay inflamed, the flare ups keep coming, and triple therapy can't fully suppress it. Dupilumab interrupts that process at the source. It's a small injection under the skin, like insulin, once every 2 weeks. And after brief training, most patients do it themselves at home. Not chemotherapy, not a steroid, not a vaccine, a precision medicine for a specific type of inflammatory COPD. But a new mechanism means nothing without proof. So here is what the trials actually showed. The BOREAS and NOTUS trials, two large international studies, thousands of patients, showed dupilumab reduced moderate to severe COPD exacerbations by up to 34% in eligible patients. Patients already on maximum inhaler still deteriorating, 34% fewer hospitalization, 34% fewer midnight calls to the 999, 34% fewer courses of steroids. NICE reviewed that evidence and in March 2026 approved dupilumab for COPD on the NHS, the first biologic injection for COPD in the history of this disease. So, who exactly qualifies? It comes down to two things, and the number that I mentioned at the start is one of them. First, you are already on maximum inhaler therapy, triple therapy, and you are still having flare ups. For some patients, being on dual bronchodilator inhaler treatment is also acceptable. Second, that number, a blood eosinophil count at or above 300 cells per microliter. Eosinophils are a type of white blood cell, and a raised level is the fingerprint of the exact inflammation dupilumab targets. Write it down, 300 or zero point 0.3 in your NHS blood results. It sits on a routine full blood count you have almost certainly already had. But unless someone knows to look for it, it goes unnoticed. So if you are exacerbating despite your inhaler and your eosinophil count is 300 or above, this injection may be for you. Now, before we go further, none of this works unless you have got the COPD basics right first. Do you actually know the difference between a bad breathing day and a genuine flare up? Is your inhaler technique correct? That clarity is the foundation everything else is built on. And it's exactly why I built the BOREAS COPD app. It helps you understand your diagnosis, track your symptoms, and recognize a real exacerbation early. So you walk into any appointment knowing your own pattern. Link is in the description box below. Now, why aren't eligible patients getting this injection yet? Most people assume NICE approval means immediate availability. It doesn't. And that gap is the whole reason Margaret waited 6 months without anyone being the villain. March 2026 was a clinical green light, but approval and access are two different things. Every hospital trust and every regional NHS funding body or the ICD has to build the infrastructure. Which teams prescribe it, which clinics run assessment, how the funding flows, how patients are referred and monitored. NICE give a standard 3 months implementation window. That's closed now. But the honest reality, which I see through my own network, is that it's happening hospital by hospital, region by region, at widely different speed. Some centers are already running biologic COPD clinics. In other areas, the pathway exists on paper but hasn't yet put a single needle in a patient. I'm not criticizing the NHS, it's building carefully. But for patients like Margaret, that gap isn't an inconvenience, it's another admission, another winter at risk. And here is something even more important. There is a reason some patients delay their own access by months without ever realizing it. Before any specialist consider you for dupilumab, they need the foundations solid. Your inhaler technique must be correct. I see patients every week who have used their inhaler wrong for years. And if a specialist finds that, they will fix your inhalers and bring you back before biologics are even discussed. And you need to understand your symptoms well enough to recognize a true exacerbation. If a team isn't confident you have that clarity, they will work through it first. This is exactly why the BREATHESE app matters. Getting your technique right and knowing your pattern isn't an obstacle to this injection. It's the prerequisite that unlocks it. So let's say the foundations are right and you qualify. Here is exactly what you do. And one detail about cost you deserve to hear before anyone else tells you. Option 1, the NHS. Ask your GP or your doctor this week for your eosinophil count. If it's 300 or above and you are still exacerbating on triple therapy, ask in this exact words for a referral to specialist respiratory clinic for COPD biologic assessment. That language tells your GP precisely what's needed and puts you in the system before everyone else catches up. Option 2, private. I can now prescribe dupilumab from my own clinics at Manchester, Liverpool, and London. But this will be private prescription only. Full transparency, dupilumab currently costs around £2,500 a month. That's not small. And you deserve to know this before a consultation, not after. But here is the good news. A second biologic, bipolizumab, has now been approved in the UK for eosinophilic COPD, and it's set to become available privately at a more affordable rate very soon. So if cost is a barrier today, you may have a cheaper option just around the corner. Subscribe to this channel so you hear it the moment it lands. So what happened to Margaret? Because her story is the reason I make these videos at all. We went through her full picture together. Eosinophil 480, 3 exacerbation in 12 months, triple therapy for 3 years, doing everything right. She qualified completely, but her local hospital hadn't opened its biologic clinic yet. The pathway in her area was still being commissioned. So she booked a private assessment for checking the eligibility for biologics. So I saw her in my clinic, discuss about the option, and she preferred to wait for the NHS to give her the medicine, which is perfectly fine. But she was aware of the private option as well. A COPD diagnosis isn't a ceiling, it's a starting point. The patients who do best aren't the ones with the mildest disease. They are the ones who understood it clearly enough to ask for what they needed. Your eosinophil count isn't just a number on a form. It's your access point to the most advanced COPD treatment available in the UK right now. If you can't afford a private treatment and also cannot access NHS treatment in the next 4 weeks, participating in clinical trials for COPD biologics is another option of getting on this treatment without paying any money. But there is no guarantee that you will actually get on the treatment arm of the clinical trial. If you want me to make a detailed video on this topic, let me know in the comment section and I will do a dedicated video on clinical trials and how you can participate in them. So your action plan: get your eosinophil count, get your inhaler technique and symptom tracking right with the BOREAS app. Then, if you're still exacerbating on triple therapy, ask for that biologic eligibility assessment, NHS or private. And if you want the full breakdown of how this injection actually works, who it's transforming, and why it's such a turning point for COPD, check out my video, COPD biologic injection. This changes everything for COPD patients next. See you on the other side.